Acceleration behind telehealth services.
In this interview, Chun Kai Chang, the Business Development Manager of Telehealth at Advantech, talks to News Medical about the acceleration behind telehealth services.
To begin, can you give us a brief introduction into telehealth and what it involves?
Telehealth is a method of providing medical care remotely, usually through a video chat. Telehealth makes it possible to connect patients and clinicians from any location. It provides access to a wide range of care, including primary care consultations, psychotherapy, physical therapy, and even emergency services. It allows primary care clinicians and specialists to further their reach for treating patients wherever there is an internet connection. The benefits of telehealth for healthcare providers and patients is that these services can be faster, safer, more effective, and less expensive in the long run, especially during a time like the COVID-19 pandemic, where telehealth has allowed access to medical care without going to hospitals to protect patients and hospital staffs from being exposed to the infection.
What are some of the main drivers behind the acceleration and momentum of telehealth services?
There are two major drivers for this fast-growing market. The first and most recent driver for telehealth has been the global COVID-19 pandemic. Strong social distancing and minimal physical contact precautions have pushed the shift to telehealth and remote consultation as it aids in infection protection. These precautions and increase in hospital bed shortages have forced medical facilities to incorporate more telehealth technologies to keep up with the demand and maintain care continuity for patients at home. The second driver is the shortage of medical professionals. When demand is increasing every year due to an aging population and more patients with chronic and non-communicable diseases. For people living in rural areas, their medical demands are underserved due to the insufficient resources and long distance to drive into cities for care. Telehealth is one of the promising ways to tackle the challenge of doctor shortages and expand specialists and doctors' reach to patients.
In terms of this acceleration and momentum of telehealth services we are currently seeing, what are some items we can expect to see in the future?
Telehealth will not replace face-to-face care services, but we will incorporate it into healthcare facilities infrastructure. Patients will be selecting providers based on their accessibilities to telehealth services. With more access to doctors, increasing patients using preventive care services and follow-up care due to convenience will start to emerge. These can lead to fewer readmissions and patient complications. We will also see more use for early screening of patients, triage in the field before they arrive at hospitals.
When it comes to remote patient monitoring for clinicians, what impact does telehealth have on this?
Remote patient monitoring could be one of the applications of telehealth. Remote patient monitoring usually involves continuously collecting patients' health data through wearable devices such as vital signs and blood sugars. The patient's data is then transmitted in real time, monitored and reviewed by medical providers. In this way, medical providers could acquire a whole picture of patients' health condition and give a more precise diagnosis.
How has telehealth shaped the way clinicians work with each other?
Clinician to clinician, telehealth services have enabled medical professionals to collaborate virtually with specialists in other locations to deliver treatment and care to patients jointly. This service can range from remote surgical monitoring to tele-ICU and tele-ER, in which on-site staff work together with a remote physician specialist team or to assess patients' condition. Telehealth solutions relieve the pressure of staffing gaps seen in critical departments such as an emergency room and ICU.
What would you say are some of the biggest challenges clinicians currently face with telehealth?
Many hospitals are still facing the lack of infrastructure to implement telehealth successfully, insufficient hardware, and the right technology for each specialty. Some hospitals struggle with reliable networking infrastructures like broadband, 4G, or Wi-Fi. This could limit the connectivity within facilities and provide remote care to rural areas or mobile clinics. Having the right technology and tools and place will be crucial to successful telehealth programs. Even though this new technology is quickly being integrated, there is a learning curve to using telehealth versus traditional healthcare operations. Users face obstacles such as learning to use different tools, online scheduling for virtual visits, triage procedures, and billing policies. To overcome these challenges, telehealth should be encouraged as a regular service and included in health insurance. There would be more motives for healthcare providers to invest in infrastructures and information system integration and deploy telehealth technology.